and we're about to start a live with Dr. Yannis Alexandridis in London. A couple of weeks ago, we had our master course in New York City. It was amazing. It was phenomenal. I mean, people even said it was a game changer, like every faculty that came in there. And what we did is we did live surgery for 3 days, had lectures. Dr. Yannis gave some amazing lectures. And then we had a cadaver lab, and what you are talking about right now for all the surgeons and non-surgeons and everybody who's watching, we demonstrated in the lab what these 5 layers of the face are, what you have to do to access layer 3 and lift it and put it back where it used to be, so patients look, as Dr. Yannis is alluding to, where they look fresher, younger, better, more attractive without looking weird or having this stigmata having lifted. That's why this patient is coming to London from far away to see Dr. Yannis and get this procedure. So I think it's very powerful, but anatomically and artistically, we demonstrated it. So for all you surgeons out there, next year, April 23rd to 26th, it's already open. People are already signing up. So we'll be there again. Tell everybody about the course and what your experience was.
Yeah, absolutely. I think it was, as you said, on a top level. I think the quality of the faculty was fantastic. It was a very open and honest meeting where people shared all the techniques, and it was really cutting edge. It's really about, we all doctors would do, you know, hundreds of these operations, but we still want to learn from each other to make it even better. So I personally feel that that was accomplished. I think the scientific part was amazing, and it's great that you're talking about the 5 layers, and I think we all need to explain maybe to our younger audience how a deep plane facelift is not just for the very aged face. On the contrary, because it works in such a anatomically correct way, it fixes problems that appear usually in the younger age, and the results we get are even more natural. So great opportunity now after this meeting to also show these results in a live surgery as well.
So I know some of you want to know about this, and you want to know what a deep plane facelift is, because that's been like the buzz term. And you know, we talked about, and Dr. Yannis can comment on this in a second, from your top of your head, your collarbone, there's a sheet of muscle, and there's 5 layers from here to here. And if you age the upper third of your face, which is the brows, the middle third of your face, which we call the nasolabial fold, and the mid face, and then from your jawline to your collarbone, which is your neck, whatever of that in you, whatever age you are, from I would say even mid to late 30s, all the way up to 70s and 80s, what have you, any of that ages, we can rejuvenate those areas. And Dr. Yannis is doing, he's going to be treating a patient who's coming from the Middle East.
Yes, the incision I'm going to use are behind the tragus, so basically will be hidden behind this part of the ear, and will follow anatomical lines. So the aim is for these incisions not to look like a scar, and obviously once they heal, they will look like natural folds of the face that we all have. In regards to the brow lift, this will be done from incisions inside the hair with the endoscope. So the length of the scar will be minimal, and also it will be hidden in the hairy part of the skull. The aim is to have a great result, but without any tell signs of scars at the end of this process.
We're not talking about non-surgical ways, meaning like fillers and Botox and things like that. We're talking about actual surgery, but the surgery is very clean, anatomical. You don't really even bruise that much. There's really not much pain. You kind of have a headache from the forehead region for it to. Dr. Yannis, talk to people about, tell them about recovery, realistic recovery, and how you do over there with your cryotherapy. And
Absolutely, yes. First of all, it's very, very important to tell our audience that this operation can be done under sedation. You don't need general anesthesia for these operations. And we use a combination of new medications and, of course, local anesthesia that makes it that possible. So, the recovery is very quick. Patients do go home after they recover. They don't stay in the hospital. And usually I let my patients fly right after I remove their stitches, which is on the 7th day after the operation. As you said already, we have a team of nurses and aestheticians who will work every day with LED light, lymphatic drainage massage. We use our traumatic healing serum, of course, which is from 111 Skin, to accelerate the healing and make that possible so patients can safely return back home right after a week. We have a fantastic team of nurses that is not just about having surgery with top surgeons, but it's also about the recovery you receive after the operation.
The attitude towards aesthetic surgery is kind of similar now to what it is in the United States, where people aren't afraid to talk about it anymore. It's not a stigma to have any kind of these surgeries anymore. So, you know, it's the more knowledge you have and the more you learn about these procedures, the less anxiety you're going to have to go talk about and get these procedures. But remember, these are permanent procedures. They'll last you, I would say, a deep plane facelift lasts at 7 to 10 years. But they all loosen up a little bit. Not that they loosen up because of what we do. It loosens up a little bit because we all, in 10 years, we're all going to be 10 years older.
I think you really summarized very well what the facial rejuvenation is about these days. So it's about natural results, results that last for a very long time with minimal scarring. We want to create not just a younger face, but a face that looks aesthetically pleasing. And overall, there is balance between the different thirds of the face, the neck, and we look at other features of the face too. So because for a lot of people, a facelift means a lot of different things. But a facelift, of course, is the restructuring upwards of the facial structures, but it may include other procedures that are very important for the overall pleasing result, such as upper and lower eyelid surgery. It can include a rhinoplasty. We talked a lot about how to do a proper upper lip lift in this conference. One of my favorite ancillary techniques is the micrografting and nanografting, with two techniques that add volume to the face if it's needed and also improve the quality of the skin, which is so important to get the best possible result.
So one more time, guys, thank you for tuning in.
See you. And for anybody who has any questions about London and 111 Harley Street, please find us on the website. It's 111harleystreet.com.
See you guys in London. Take care.
Bye.